Question 1. In light of recent developments in functional neuroimaging, Dr. Patel is analyzing a patient with suspected eloquent cortex involvement due to a glioma. He is considering the use of task-based ARI to delineate motor and language regions before surgical resection. However, the patient has difficulty following complex instructions and is non-compliant during the task-based FRI acquisition. Given this scenario, what would be the appropriate imaging approach? A. Resting state functional MRI. B. Repeat task-based ARI with different tasks. C. Diffusion-weighted imaging DWI to map motor tracts. D. Digital subtraction angiography (ESA) to assess blood flow. Answer. Correct answer A. Resting state functional MRI. Explanation. Task-based FRI relies on patient compliance and active participation, making it less effective in non-compliant patients. Resting state FRI, however, allows the identification of functional networks without requiring patient cooperation. Studies have shown RARI to be an effective alternative in preoperative planning, particularly for eloquent cortex mapping. DWI is useful for white matter tractography but does not provide cortical functional localization. DSA, while useful for vascular anatomy, does not assess functional connectivity. Question 2. 55-year-old male presents with acute onset right-sided weakness and aphasia. An emergency non-contrast CT shows no hemorrhage. The attending physician orders a diffusion weight MRI, which reveals an area of high signal in the left MEA territory on DWI with corresponding low key values. What is the most likely interpretation of these findings? A. Chronic infarction. B. Acute ischemic stroke. C. Vasogenic edema. D. Glioblastoma. Answer. Correct answer. B. Acute ischemic stroke. Explanation. DWI is highly sensitive to cytotoxic edema, which occurs in acute ischemic stroke due to cellular energy failure and restricted water diffusion. High DWI signal with low values confirms acute infarction. Chronic infarction typically shows normal or increased AG. Vasogenic edema, such as in tumors or infections, demonstrates high ICI values due to extracellular fluid accumulation. Glioblastoma may have mixed DWI signal but is not typically restricted like an acute infarction. Question 3. Dr. Lin is reviewing an MRI of a 45-year-old female with seizures. The imaging reveals a hyperintense, non-enhancing lesion in the left frontal lobe with subtle cortical involvement. Fusion imaging shows decreased relative cerebral blood volume (REE), which tumor subtype is most likely based on these findings. A. Glioblastoma. B. Low-grade glioma. E. G. Oligodendroglioma or astrocytoma. C. Meningioma. D. Brain metastases. Answer. Correct answer B. Low-grade glioma. G. Oligodendroglioma or astrocytoma. Explanation. Low-grade gliomas are typically non-enhancing in MRI, often involve the cortex and show low perfusor REV or perfusion imaging. In contrast, glioblastomas exhibit ring enhancement, necrosis, and high REE. Meningiomas are extraxial tumors and typically strongly enhanced. Brain metastases are often multiple and enhanced post-contrast. Question 4. Which of the following techniques is most effective in reducing radiation dose during a CT angiography of the head and neck? A. Increasing two-current MAR. B. Increasing KVP to 140. C. Using automatic two-current modulation ACM. D. Scanning at a higher pitch. E. G. 0.2 instead of 1.5. Answer. Correct answer. C. Using automatic two-current modulation ACM. Explanation. ACM dynamically adjusts the two current based on patient size and anatomy, significantly reducing radiation exposure while maintaining diagnostic quality. Increasing or KVP leads to higher dose, a lower pitch increases overlap and dose, while a higher pitch reduces image quality and vascular imaging. Question 5. Which MRI feature is most suggestive of normal pressure hydrocephalus in PHA? Ventriculomgaly with Sylvian fissure widening. B. Paraventricular T hyperintensity with no ventricular dilation. C. Small lateral ventricles with prominent cystins. D. Enlarged lateral ventricles with cerebellar atrophy. Answer. Correct answer A. Ventriculomgaly with Sylvian fissure widening. Explanation. NPH is characterized by ventriculomegaly with disproportionate widening of the Sylvian fissures and narrowing of the high convexity sulci. Paraventricular hyperintensities can be seen due to CSF transependymal absorption. Small ventricles suggest atrophic processes rather than hydrocephalus. Question 6. Dr. Carter is examining a 60-year-old patient who presents with sudden onset vertigo, dysarthria, and ataxia. Aiken reveals a hyperdense lesion in the posterior fossa. The patient's history includes family history of cerebrovascular events. Given the patient's clinical presentation and imaging, what is the most likely diagnosis? A. Cerebellar infarct due to vertebrobasilar occlusion. B. Cerebellar hemorrhage due to an arteriovenous malformation evum. C. Posterior circulation ischemic stroke. D. Medullary germa. Answer. Correct answer. B. Cerebellar hemorrhage due to an arteriovenous malformation evum. Explanation. A hyperdense lesion in the posterior fossa on CT, especially with a family history of cerebrovascular events, raises suspicion for cerebellar hemorrhage, often secondary to an evum. Evums in the posterior circulation commonly present with hemorrhagic events. A cerebellar infarct would typically not appear as hyperdense on CT. An ischemic stroke would be more likely to show hyperdensity. Medullary gliomas were generally present as intracerebral masses, but hemorrhage is not characteristic. Question 7. Ms. Roberts, a 45-year-old female, presents with radicular pain and motor weakness in the lower extremities. Her previous MRI was inconclusive, so an earlogram is performed. The CT images reveal compression at the ear level with a large disc herniation. Based on these findings, what is the most likely cause of her symptoms? A. Spinal cord tumor. B. Lumbar disc herniation. C. Vertebral fracture. D. Epidural abscess. Answer. Correct answer. B. Lumbar disc herniation. Explanation. CT myelography is highly sensitive in visualizing disc herniations, which often cause compression of the nerve roots, leading to radicular pain and motor weakness. The lumbar spine is the most common location for disc herniations, particularly at the low level. Spinal cord tumors tend to cause diffuse symptoms and do not typically present with localized nerve root compression. The fractures are often seen on plain radiographs and may not require CT myelography unless there is concern for cord involvement. Epidural abscesses generally present with signs of infection, including fever, and would be associated with enhancing lesions on C. Question 8. In a trauma case involving a 28-year-old male who was involved in a motor vehicle accident, an emergency MRI of the cervical spine shows an incomplete spinal cord injury at C with associated epidural hematoma. What is the most appropriate management for this patient? A. Immediate surgical decompression and hematoma evacuation. B. Conservative management with bed rest and monitoring. C. Intravenous corticosteroids for spinal cord protection. D. Long-term physical therapy and rehabilitation. Answer. Correct answer. A. Immediate surgical decompression and hematoma evacuation. Explanation. In the case of an epidural hematoma associated with spinal cord injury, immediate surgical decompression is essential to relieve pressure on the spinal cord and prevent further neurological damage. Conservative management may be appropriate for minor injuries, but when significant compression is present, surgery is often required. The use of corticosteroids has been largely debunked for acute spinal cord injuries due to lack of significant benefit and potential harm. While rehabilitation is crucial in the recovery process, it is not the first-line treatment for an acute epidural hematoma. Question 9. A 5-year-old child presents with headache, vomiting, and developmental delay. An MRI of the brain reveals a cystic lesion with an enhancing neural nodule in the posterior fossa. Given these findings, which of the following is the most likely diagnosis? A. Medulloblastoma. B. Pilocytic astrocytoma. C. Ependymoma. D. Craniopharyngioma. Answer. Correct answer. B. Pilocytic astrocytoma. Explanation. A cystic lesion with an enhancing neural nodule in the posterior fossa is characteristic of a pilocytic astrocytoma, a common benign pediatric brain tumor. These tumors often have a cystic component with an enhancing solid nodule, most commonly located in the cerebellum. Medulloblastomas are solid tumors with invasive growth and would not typically have a cystic appearance. Ependymomas are more commonly located in the ventricular system and present as solid masses. Craniopharyngiomas are more commonly located supraocellular and present with symptoms of hypothalamic dysfunction rather than developmental delay. Question 10. Dr. Hughes is evaluating a 72-year-old male patient who presents with progressive memory loss, difficulty with speech, and bradykinesia. Findings show atrophy of the hippocampus and substantia nigra. Based on these findings, what is the most likely diagnosis? A. Alzheimer's disease. B. Parkinson's disease with dementia. C. Amyotrophic lateral sclerosis ALS. D. Multiple system atrophy MSA. Answer. Correct answer. B. Parkinson's disease with dementia. Explanation. The combination of memory loss, speech difficulties, and bradykinesia suggests Parkinson's disease with dementia PDD. MRI findings of hippocampal atrophy and substantia nigra degeneration are consistent with Parkinson's disease, which often progresses to dementia in advanced stages. Alzheimer's disease typically presents with predominant cortical atrophy and amnesia rather than the motor symptoms seen in Parkinson's. ALS primarily affects motor neurons and does not typically present with the cognitive symptoms observed here. Multiple system atrophy often involves more widespread atrophy and autonomic dysfunction. Question 11. In the context of detailed anatomical knowledge required for complex neurosurgical procedures, Dr. Smith is planning a surgical intervention on a 48-year-old male who has developed a lesion near the ventrolateral aspect of the medulla oblongata. The patient presents with dysphagia, dysarthria, and mild contralateral hemiparesis. Given the critical importance of preserving vital structures such as the corticospinal and corticobal tracts, Dr. Smith reviews high-resolution imaging to delineate the precise neuroanatomy. The imaging indicates a subtle displacement of white matter tracts, and there is a need to identify the landmark that reliably represents the location of the corticospinal tract fibers before their decussation. With the complexity of the brainstem anatomy and the possibility of anatomical variations, which landmark is most useful to guide the surgical approach? A. Inferior olivary nucleus. B. Fourth ventricle. C. Pyramid of the medulla. D. Cerebellar peduncle. Answer. Correct answer. C. Pyramid of the medulla. Explanation. The pyramid of the medulla is a well-known anatomical landmark where the majority of corticospinal fibers converge and subsequently decussate. Identifying the pyramid is essential in planning surgical interventions as it helps differentiate between motor tracts and adjacent cranial nerve nuclei. Damage to the pyramidal tract can result in significant motor deficits. In contrast, the inferior olivary nucleus and cerebellar peduncles are involved in motor coordination and balance rather than direct motor conduction, and the fourth ventricle is primarily a cerebrospinal fluid (CSF) space. Question 12. In light of recent developments in neonatal imaging, Dr. Rodriguez is evaluating a newborn who presents with signs of hydrocephalus facial dysmorphism and developmental delay. Advanced MRI studies reveal an abnormal ventricular system with a single ventricle and absent midline cleavage. The clinical and imaging findings raise a suspicion of a congenital forebrain anomaly, considering the complex processes involved in brain development, particularly the timing of neural tube closure, neuronal migration, and midline division. Identifying the disrupted process is critical for diagnosis and counseling. Which embryological process is most likely disrupted in this case, leading to the clinical syndrome observed? A. Neural tube closure. B. Cerebral gyrification. C. Myelination. D. Forebrain cleavage. Answer. Correct answer. D. Forebrain cleavage. Explanation. The imaging findings of a single ventricular cavity and absence of midline separation are characteristic of holoprosencephaly, disorder resulting from impaired forebrain cleavage during embryogenesis. This disruption affects the proper division of the embryonic forebrain into two hemispheres, leading to spectrum of facial and cerebral malformations. While neural tube closure is essential, formation of the CNS and gyrification and myelination are critical later in development. It is the failure of forebrain cleavage that best explains the observed anomaly. Question 13. Based on the information provided, Dr. Thompson is managing a 50-year-old male who presents with sudden onset severe headache and confusion following minor head trauma. A non-contrast CT scan reveals subtle hyperdensities in the subarachnoid space, raising concern for an early aneurysmal bleed. Given the urgency of the situation and the need for enhanced detection sensitivity of acute hemorrhage while also minimizing radiation exposure, Thompson is considering advanced CT protocols. Which CT technique and protocol modification is most recommended in this scenario? A. Non-contrast CT with high pitch. B. Dual entity CT imaging. C. CT perfusion imaging. D. CT angiography with high A. Answer. Correct answer. B. Dual entity CT imaging. Explanation. Dual entity CT imaging utilizes two different energy spectra to distinguish materials based on their atomic numbers, which improves the differentiation between blood and surrounding tissues. This technique enhances the detection of subtle hemorrhages, particularly in the acute phase, while potentially reducing artifacts and unnecessary radiation dose. In contrast, standard non-contrast CT with high pitch might compromise image resolution. CT perfusion is tailored to evaluate cerebral blood flow rather than hemorrhage, and high kVp protocols can increase radiation dose without significant benefit in this scenario. Question 14. Through the lens of advanced imaging techniques, Dr. Nguyen is evaluating a 40-year-old female who sustained a motor vehicle accident with suspected traumatic axonal injury type. The patient's conventional MRI is inconclusive, but she exhibits subtle deficits in coordination and memory. Dr. Nguyen opts for diffusion tensor imaging (DTI) to assess the integrity of the white matter tracts, which are suspected to be disrupted. DTI allows quantification of microstructural changes in white matter by measuring water diffusion and anisotropy. Which of the following DTI parameters is most indicative of microstructural damage within the white matter tracts and would be most sensitive to detecting these subtle injuries? A. Fractional anisotropy FO. B. Mean diffusivity MD. C. Apparent diffusion coefficient AC. D. Radial diffusivity RD. Answer. Correct answer A. Fractional anisotropy FA. Explanation. Fractional anisotropy FA is a key DTI metric that quantifies the directional dependence of water diffusion in white matter tracts. A decrease in FA values is strongly associated with microstructural damage, and disruption of fiber integrity is seen in traumatic axonal injury, while mean diffusivity and key provide information on overall water mobility. FOSP reflects the organization and directional coherence of fiber tracts, making it more sensitive to axonal injury. Radial diffusivity can also indicate demyelination, but FA remains the primary parameter for assessing fiber integrity in TI cases. Question 15. When considering the evidence that metabolic imaging can significantly enhance the diagnostic accuracy for brain tumors, Dr. Ahmed is presented with the case of a 35-year-old male with an ambiguous intracranial lesion. Conventional MRI sequences reveal a poorly defined mass, prompting the use of MR spectroscopy for further characterization. The spectroscopic profile reveals an elevated choline peak along with a reduction in acetylaspartate NA, indicating increased cellular turnover and neuronal loss. Based on this metabolic profile, which diagnosis is most consistent with these findings, and what does this imply regarding the lesion's aggressiveness? A. Low-grade glioma. B. Abscess. C. High-grade glioma. D. Demyelinating lesion. Answer. Correct answer. C. High-grade glioma. Explanation. An elevated choline peak is indicative of increased membrane turnover and cellular proliferation, while decreased NA reflects neuronal loss. This spectroscopic profile is most consistent with a high-grade glioma, which is known for its aggressive behavior and rapid growth. Low-grade gliomas tend to have a less pronounced choline elevation and relatively preserved NA levels, while abscesses, demyelinating lesions exhibit distinct metabolic patterns not characterized by this combination of changes. Question 16. According to recent studies on optimizing vascular imaging, Dr. White is preparing to perform digital subtraction angiography (DSA), a 62-year-old patient with a history of transient ischemic attacks and hypertension, now suspected of harboring an intracranial aneurysm. Given the procedural risks such as catheter-induced complications and contrast reactions, careful technique is paramount. The imaging protocol includes projections to fully delineate the vascular anatomy and aneurysm morphology. What is the most critical factor in reducing procedural risks while ensuring high-quality angiographic images during DSA? A. Using high-concentration contrast media. B. Optimal catheter positioning and selective injection. C. Performing the procedure under general anesthesia. D. Increasing the radiation dose for clear images. Answer. Correct answer B. Optimal catheter positioning and selective injection. Explanation. Optimal catheter positioning and the use of selective contrast injection are essential for reducing both procedural risks and contrast volume, thereby minimizing the potential for complications such as vessel injury or contrast-induced nephropathy. This technique also enhances image quality by providing focused visualization of the area of interest. High concentration contrast and high radiation doses are not routinely recommended due to increased risks, and general anesthesia is not necessary in every case. Question 17. During the process of evaluating a 68-year-old male with progressive motor deficits, cognitive decline, and a noticeable slowing of movements, Octalee is faced with a diagnostic challenge due to overlapping features seen in multiple neurodegenerative disorders. Advanced MRI imaging demonstrates significant atrophy of the hippocampus alongside changes in the substantia nigra as well as diffuse cortical thinning. Given these complex findings, which diagnosis best fits the overall clinical and imaging presentation, and what additional clinical tests could further differentiate this condition from pure Alzheimer's disease? A. Amyotrophic lateral sclerosis ALS. B. Frontotemporal dementia. C. Vascular dementia. D. Parkinson's disease with dementia. Answer. Correct answer D. Parkinson's disease with dementia. Explanation. The combination of motor symptoms, bradykinesia with cognitive decline, along with imaging findings showing atrophy of both the hippocampus and the substantia nigra, is most consistent with Parkinson's disease with dementia. While Alzheimer's disease primarily affects memory and cortical regions, Parkinson's disease with dementia reflects a mixed picture that includes both motor dysfunction, cognitive impairment. Additional clinical tests, such as dopamine transporter DAT imaging, can help differentiate Parkinson's pathology from Alzheimer's disease by assessing nigrostriatal dopaminergic function. Question 18. Taking into account the data on interventional treatments for osteoporotic vertebral fractures, Dr. Brown is evaluating a 75-year-old female with chronic back pain following a compression fracture at the T-level. The patient has failed conservative management, including pain medication and physical therapy. Advanced imaging confirms a vertebral compression fracture with loss of vertebral height and focal kyphotic deformity. In order to stabilize the fracture and potentially restore vertebral height to alleviate pain, which of the following procedures is most appropriate for this patient? A. Kyphoplasty. B. Spinal fusion. C. Epidural steroid injection. D. Laminectomy. Answer. Correct answer A. Kyphoplasty. Explanation. Kyphoplasty is an interventional procedure specifically designed for osteoporotic vertebral compression fractures. It involves the insertion of a balloon tamp to restore vertebral height, followed by cement injection to stabilize the fracture, thereby providing rapid pain relief and correcting deformity. Spinal fusion is typically reserved for instability due to degenerative disease or trauma, while steroid injections offer only temporary relief, and laminectomy is more appropriate for decompression in cases of neural impingement. Question 19. Given the circumstances, Dr. Gomez is evaluating a 10-year-old child who presents with sudden onset unilateral weakness, slurred speech, and facial droop. The child's medical history reveals congenital heart disease with known right-to-left shunt MRI studies demonstrate an acute ischemic infarct in the middle cerebral artery territory. In the context of pediatric stroke, the underlying mechanism may differ from adults. A child's congenital heart condition could predispose to certain embolic events. Which of the following is the most likely explanation for the child's stroke, and how does the congenital cardiac anomaly contribute to this event? A. Hemorrhagic stroke due to AVM rupture. B. Ischemic stroke due to paradoxical embolism from right to left shunt. C. Migraine with aura causing transient ischemic attacks. D. Brain tumor with secondary vascular compromise. Answer. Correct answer B. Ischemic stroke due to paradoxical embolism from a right to left shunt. Explanation. In children with congenital heart disease, and a right to left shunt paradoxical embolism is a well-recognized mechanism for ischemic stroke. Emboli that would normally be filtered by the pulmonary circulation can bypass the lungs and enter the systemic circulation, thereby occluding cerebral vessels. Hemorrhagic stroke and brain tumors with different imaging and clinical features, and migraine with aura typically transient without lasting infarction. Question 20. Considering the evidence that artificial intelligence (AI) is increasingly being integrated into neuroradiology, Dr. Zhang is conducting research to evaluate the performance of a deep learning algorithm in differentiating intracranial neoplastic lesions from non-neoplastic abnormalities. The algorithm is trained on a large dataset of MRI scans, and its diagnostic accuracy is being compared with expert neuroradiology interpretations. Among various performance metrics, one parameter is chosen to summarize the algorithm's overall ability to discriminate between disease states across different decision thresholds. Which of the following metrics is most essential for determining the diagnostic accuracy and clinical utility of the AI algorithm in this context? A. Sensitivity. B. Specificity. C. Area under the ROC curve. Or D. Negative predictive value. Answer. Correct answer C. Area under the ROC curve. Or explanation. The area under the receiver operating characteristic ROC curve is a comprehensive metric that summarizes the overall performance of a diagnostic test across all possible classification thresholds. A higher ORC indicates better discrimination between neoplastic and non-neoplastic lesions, while sensitivity and specificity provide important insights at specific thresholds or offers. Global measure of diagnostic accuracy. Negative predictive value is dependent on disease prevalence and is less informative in a research setting where population characteristics vary. Question 21. Among the various challenges in managing patients with chronic neurological disorders, Dr. Rivera is overseeing the follow-up of a 57-year-old female with relapsing remitting multiple sclerosis (MS). The patient has reported new-onset mild weakness and blurred vision. Her previous MRI studies demonstrated multiple white matter lesions, and now there is a need to determine if any lesions are currently active or if new inflammatory foci develop. Dr. Rivera is aware that the choice of MRI sequences is critical for detecting active demyelinating plaques versus chronic, stable lesions. She reviews several protocol modifications that could improve the detection of blood-brain barrier disruption and subtle inflammatory changes. Given the importance of capturing gadolinium enhancement in active lesions, which MRI sequence modification would be most appropriate to evaluate the current activity? A. Fluid attenuated inversion recovery FLAIR sequence. B. Tweighted post-contrast sequence. C. Tweighted spin echo sequence. D. Diffusion-weighted imaging Dwyer sequence. Answer. Correct answer. B. Tweighted post-contrast sequence. Explanation. Active demyelinating lesions in MS typically show blood-brain barrier disruption that allows gadolinium contrast to leak into the lesion, resulting in enhancement on tweighted images. Tweighted post-contrast sequences are thus essential for detecting acute inflammatory activity. FLAIR sequences are excellent for lesion burden evaluation but are less specific for active inflammation. Tweighted sequences provide good anatomical detail but do not distinguish active from chronic lesions. TWI is useful in acute ischemia rather than inflammatory changes. Question 22. From the perspective of advanced stroke imaging, Dr. Lee is managing a 62-year-old male with a history of hypertension who recently underwent endovascular therapy for a high-grade glioma. During follow-up, the patient develops neurological deficits that raise concerns for tumor recurrence versus treatment-related changes. Advanced perfusion imaging is considered to help differentiate these entities. Dr. Lee reviews several perfusion techniques that provide quantitative parameters such as cerebral blood volume (CBV) and blood flow. In the context of this case, determining whether the lesion represents true tumor progression with neovascularity or pseudoprogression due to post-treatment inflammation is critical. Which perfusion technique is most sensitive and widely used in differentiating recurrent tumor from radiation necrosis? Post-therapy evaluations. A. Arterial spin labeling (ASL). B. Dynamic contrast enhanced (DCE) imaging. C. Dynamic susceptibility contrast (DSC) imaging. D. CT perfusion imaging. Answer. Correct answer. C. Dynamic susceptibility contrast DSC imaging. Explanation. DSC imaging is widely used in neuro-oncology to evaluate perfusion parameters such as relative cerebral blood volume EV, which helps distinguish recurrent tumor with elevated EV due to neovascularity from radiation necrosis with EV. Although ISLA and EC have their roles, ESC remains the standard. Differentiation. CT perfusion is less commonly employed in the post-therapy brain tumor setting due to radiation exposure concerns and lower sensitivity to subtle vascular changes. Question 23. In the context of metabolic imaging advancements, Optachandra is evaluating a 55-year-old female who presents with a new, poorly defined intracranial mass discovered incidentally during workup for seizures. Conventional MRI sequences provided inconclusive findings, and Optachandra has turned to MR spectroscopy for further tissue characterization. The spectroscopic profile reveals an elevated choline peak along with a reduction in N-acetyl aspartate, now suggesting high cellular turnover and neuronal loss. With the metabolic information in hand, the differential diagnosis includes various tumor grades. To best assess the lesion's aggressiveness, which spectroscopic parameter is most indicative of high-grade neoplasm? A. Decreased choline creatine ratio. B. Elevated myoinositol creatine ratio. C. Increased NAR peak relative to creatine. D. Elevated choline NAR ratio. Answer. Correct answer. D. Elevated choline NAR ratio. Explanation. An elevated choline NAR ratio is highly suggestive of a high-grade tumor, as increased choline reflects accelerated cell membrane turnover, while decreased NAR indicates neuronal loss. This combination is characteristic of aggressive neoplastic processes. In contrast, decreased choline creatine and increased NAR are not consistent with high-grade malignancies, and myoinositol elevation is associated with giosis or low-grade pathology. Question 24. Under the assumption that vascular imaging is pivotal in cerebrovascular pathology, Optacim is managing a 48-year-old male who presented to the emergency department with a sudden severe headache and neck pain. Clinical suspicion for carotid dissection is high based on the patient's history of minor neck trauma and the acute onset of symptoms. Optacim proceeds with digital subtraction angiography (DSA) to obtain high-resolution images of the cervical vasculature. The imaging reveals subtle luminal irregularity with tapering of the vessel and long, thin area of narrowing. In this setting, with ESA finding is considered most diagnostic for carotid dissection and critical for guiding further management. A. String sign. B. Double lumen formation. C. Pseudoneurism formation. D. Diffuse vessel irregularity. Answer. Correct answer A. String sign. Explanation. The string sign is classic DSA finding in carotid dissection, representing long, narrowed segment of the artery due to intramural hematoma or intimal disruption. While double lumen formation is also seen in dissections, it is less frequently observed. Pseudoneurism formation may occur later, and diffuse vessel irregularity is non-specific. Recognizing the string sign is vital because it necessitates prompt antithrombotic therapy to prevent ischemic complications. Question 25. Considering the evidence that timely imaging plays a critical role in the management of demyelinating diseases, Patel is following up with a 36-year-old female known to have multiple sclerosis who now presents with new neurological deficits. An MRI study is performed and multiple lesions are seen in the paraventricular white matter. However, the challenge lies in distinguishing acute active plaques from chronic, non-enhancing lesions. Complex clinical scenario, which imaging feature is most indicative of an acute demyelinating lesion, thereby influencing immediate treatment decisions. A. Homogeneous T hyperintensity without enhancement. B. Open ring enhancement on post-contrast weighted images. C. Central vein sign on susceptibility imaging. D. T hypointensity black hole appearance. Answer. Correct answer B. Open ring enhancement on post-contrast weighted images. Explanation. Open ring enhancement is highly specific for active demyelinating lesions, reflecting active inflammation with partial breakdown of the blood-brain barrier. In contrast, non-enhancing T hyperintense lesions suggest chronicity, while the central vein sign, although supportive of MS, is not exclusively diagnostic of an active lesion. T hypointense. The black holes indicate severe damage from chronic demyelination. Recognizing the open ring enhancement pattern is critical for guiding acute therapeutic interventions in MS exacerbations. Question 26. In the framework of integrating multimodal imaging for tumor characterization, Dr. Novak is evaluating a 50-year-old male who presents with new-onset seizures and personality changes. MRI reveals a lobulated lesion in the left temporal lobe that exhibits heterogeneous signal characteristics. The lesion appears partially calcified, and the radiologist notes that these calcifications are better appreciated on susceptibility with imaging SWA. Given the imaging findings in clinical scenario, which feature is most suggestive of an oligodendroglioma, and how does this influence management decisions regarding tumor grading and surgical planning? A. Homogeneous contrast enhancement throughout the lesion. B. Predominantly cystic appearance with minimal calcification. C. Cortical calcifications within the tumor. D. Minimal peritumoral edema with diffuse infiltration. Answer. Correct answer. C. Cortical calcifications within the tumor. Explanation. Oligodendrogliomas often exhibit calcifications within the tumor, which can be detected on both ET and MRI, especially on SWI. This imaging feature, along with the lesion's location and clinical presentation, is suggestive of oligodendroglioma. The presence of calcification is an important clue that may affect both the histopathological grading and surgical planning, as these tumors generally have more indolent course compared to high-grade gliomas. Question 27. During the process of evaluating a 40-year-old male with progressive lower extremity weakness and sensory deficits, Dr. Evans orders a high-resolution MRI of the spinal cord. The imaging reveals an intramedullary lesion extending from the level with heterogeneous signal intensity and mild cord expansion. Given the patient's age and clinical presentation, the differential diagnosis includes several primary spinal cord tumors. Which intramedullary tumor is most likely in this scenario based on the lesion's characteristics and anatomical location, and what are the implications for surgical intervention? A. Meningioma. B. Nerve sheath tumor. C. Astrocytoma. D. Ependymoma. Answer. Correct answer. D. Ependymoma. Explanation. Ependymomas are the most common intramedullary spinal cord tumors in adults and frequently occur in the thoracic spinal cord. They typically present as well circumscribed lesions that may cause cord expansion and heterogeneous signal intensity. In contrast, meningiomas and nerve sheath tumors are usually extramedullary, and astrocytomas tend to occur in a younger population with more diffuse cord involvement. Early surgical resection is often indicated for ependymomas, as they are usually well demarcated, allowing for gross total resection and better neurological outcomes. Question 20. During the process of evaluating pediatric patients with congenital spinal anomalies, Dr. Morgan is tasked with assessing a 12-year-old child who presents with scoliosis and subtle neurological deficits, including lower extremity weakness and bladder dysfunction. Previous MRI studies were inconclusive in demonstrating a clear anatomical cause for the neurological symptoms. Dr. Morgan opts for a ELogram to obtain better visualization of the spinal canal and potential tethering of the spinal cord. The imaging reveals a low-lying conus medullaris with a thickened filum terminale, findings that correlate with the patient's clinical presentation. Which diagnosis is most consistent with these imaging findings and the patient's symptoms? A. Tethered cord syndrome. B. Syringomyelia. C. Chiari malformation. D. Disc herniation. Answer. Correct answer. A. Tethered cord syndrome. Explanation. A low-lying conus medullaris with a thickened filum terminale is characteristic of tethered cord syndrome, a congenital anomaly in which the spinal cord is abnormally attached, leading to stretching and neurological deficits. Syringomyelia, Chiari malformation, and disc herniation present with distinct imaging features that do not match the described findings. Early identification of tethered cord syndrome is crucial, as timely surgical intervention can prevent progressive neurological deterioration. Question 29. Considering the complex anatomy of the orbit and its implications for visual function, Dr. Reyes is evaluating a 35-year-old female who presents with progressive proptosis, diplopia, and intermittent periocular pain. The patient's ophthalmologic examination reveals decreased visual acuity, and an orbital MRI is ordered for further evaluation. The imaging study demonstrates well-circumscribed ovoid mass in the orbital apex, homogeneous enhancement, and smooth margins. Given the patient's clinical presentation and imaging findings, which orbital lesion is most consistent with these characteristics, and what are the potential treatment implications? A. Optic nerve glioma. B. Cavernous hemangioma. C. Orbital pseudotumor. D. Meningioma. Answer. Correct answer. B. Cavernous hemangioma. Explanation. Cavernous hemangioma is the most common benign orbital tumor in adults, typically presenting as a well-circumscribed enhancing mass in the orbital apex. Its smooth margins and homogeneous enhancement and MRI help differentiate it from other orbital lesions such as optic nerve glioma, which involves the nerve itself, orbital pseudotumor, usually ill-defined and inflammatory, meningioma, often involving the optic nerve sheath with calcification. Correct identification of a cavernous hemangioma guides management toward conservative monitoring or surgical excision if symptomatic. Question 30. Throughout the course of modern neuroradiology practice, Dr. Wang is responsible for producing comprehensive structured reports for complex cases that often involve multiple abnormalities. In one recent case, a 68-year-old patient with a history of cerebrovascular disease and suspected neoplasm underwent several imaging studies. Dr. Wang must now compile a report that not only describes the imaging findings in detail, but also provides clear, actionable recommendations to the referring physician. Given the increasing emphasis on standardized reporting to reduce variability and enhance communication, which element is most critical to include in a structured neuroradiology report to ensure that it directly informs clinical management decisions? A structured presentation of findings including key abnormalities and their clinical significance. B. Detailed technical scanning parameters and acquisition details. C. An exhaustive listing of all incidental normal variants. D. A comprehensive narrative of the patient's medical history and prior imaging. Answer. Correct answer. D. A concise impression summarizing key findings and actionable recommendations. Explanation. While detailed technical parameters and patient history are important, the most critical element in a structured report is a concise impression that summarizes the key findings and provides clear, actionable recommendations. This concise section bridges the gap between imaging data and clinical management, ensuring that the referring physician understands the significance of the findings and the recommended next steps. The structured impression directly impacts patient care by guiding treatment decisions, referrals, and follow-up imaging.